structure to the population to Washington State. And ethnicity-wise, 65% of the population of the sample was Caucasian, whereas in Washington State, 87% of the population is Caucasian. So ethnicity matchup isn't exactly the same. You can look at the rest of the numbers here. Majority of the patients did have some form of health insurance, and that was very similar to Washington State averages. So just to give you a quick rundown, 4 of the patients told me that they had been diagnosed with this qualifying condition of cancer. 6 had been diagnosed with HIV, 6 with multiple sclerosis, 3 with epilepsy, 8 with spasticity disorders, 16 with intractable pain, 2 with glaucoma, 1 with Crohn's disease, 4 with hepatitis C, and 14 with this catch-all category: nausea, vomiting, wasting, appetite loss, cramping, seizures, muscle spasms, spasticity, any other condition is what that's titled. So as you can see, most patients could choose more than one qualifying condition. These numbers add up to more than 37. But oftentimes patients were diagnosed with more than one condition. So, and there had been no information on what the breakdown of those conditions looked like in the population using this treatment. So it's very interesting to see that Washington actually has picked the right conditions, so these patients are using it appropriately. So these are additional other conditions that were noted in the population: depression, migraine, persistent nausea, arthritis. These are ranked by frequency. It's interesting that patients were given a list of conditions that are known based on lab physiology studies, based on other surveys in the population, to be responsive to cannabinoid treatment, and a number of them also, in fact, did have those conditions as well. So there is sort of a scientific consistency to this clustering of illnesses. I should also note 2 patients reported successful substitution therapy for methamphetamine use disorders. Anti-gateway effect. Symptom control by body system was then asked. This is taken from the review of systems, which is part of the medical history database that's normally asked patients. And I went through and chose the type of treatments of symptoms that were known to be responsive to cannabinoids based on the endocannabinoid system. And patients were asked, do you use cannabis to treat any of these symptoms? And how effective is it on a scale of 1 to 10? The most frequently reported symptom was to reduce anxiety, 71%. Second was to improve mood. Third was to reduce nausea. Fourth, to stimulate appetite. Fifth, to reduce musculoskeletal pain. And so on. You can see the distribution. Ironically, in Washington State, psychiatric symptomology is not covered are not primary qualifying conditions under the state law. So it's interesting to see these are likely anxiety, mood related to the physical illnesses these patients are experiencing, or they could be completely, unrelated, dual diagnosis sort of situations, unclear. Some patients, I just put some of their notes. I asked them what their most frequent symptom they used to treat. I received numbness in my legs, and the marijuana relieves a tense, throbbing feeling. I run every night, and it is the marijuana that eliminates all pain, which is like a tuning fork multiplied by 100% of my legs. So patients get very descriptive, give an open field to write on their symptom, what symptoms they use mainly. Headaches, breast pain, nausea. This patient was a breast cancer survivor. Then a little bit of information on health-related quality of life. I'm not going to go through all of these numbers with you, but just note that these are standardized instruments that are used across the country and across the world to gauge quality of life related to health. So one famous one is the SF36, the Medical Outcomes Survey. The sample had an average of 49 out of 100 on that sample. In the general population, the sample average is 80 out of 100. So roughly half. General health was indicated as fair to good, whereas in Washington State, most people say their health is good to very good. Days that meant physical health was not good was about 4 times higher than the Washington State average. Days that mental health was not good was almost about 4 times higher than the Washington State average. Unhealthy days were 3 times higher than the Washington State average. You get the picture. These are very specific ways to look at how people how their health affects their life quality. And you can see that this population is 3 to 4 times more ill than the national and state averages. Also, I asked about major impairments that they faced. 29 of the patients in the sample said that they had major limitations, and 17 of them needed help with routine needs, 7 needed help with personal care needs. So this is also a limited mobility population. 5 patients returned take-home questionnaires, and just you should note that this is not a representative sample of the total sample. These are just the patients who returned it. But it's interesting to note that most of them live very close to the clinic, 5 to 10 miles. Most of them they used a variety of methods to ingest cannabis: inhalation, by smoking, by vaporization, with baked goods, etc. I won't go into all this, but interestingly enough, the relationship that patients have with cannabis goes beyond a medicine recommended by their doctor. Some of them actually have particular spiritual or religious views regarding cannabis, and some of them have a kind of relationship, human-plant relationship. When I have plants, I feel a relationship of love and respect and awe, some patient wrote. But other patients really found that it's a bother. Frankly, it's a bother due to the quasi-legality issue, which is a really interesting kind of response to see. So the range of responses on these kind of questions. Won't bore you about this, but just know that there were interesting changes noted on their quality of life scales after they had finished the cannabis that they had received that day. And this isn't a controlled sample, so I can't really make much out of this, but you can see that, for example, like pain difficult days for almost all patients except this patient went down. You can look at more of this in detail, we can talk about later. But dosing diaries were also very helpful to kind of see on a dose-by-dose basis how patients treated their particular symptoms. Okay, so let's see here. What I'm going to do now is talk a little bit about what I think is the most critical part of this story, which is how patients are dealing with the range of legal limbos that they are in, let's just say. So this is one patient who, these patients aren't in the study. Again, I've just sort of sprinkled a few pictures here of actual patients who are facing different degrees of legal distress related to their involvement with medical marijuana. Here's a patient whose case actually went to the Washington State Supreme Court, was denied relief there, and had to seek sentencing at a Skamania County courthouse. She had a number of GI conditions, multiple surgeries. So why am I talking about contraband biota? Because that's the kind of category of thing in the world that cannabis falls into. These are the other seeds, other germplasms that are basically matters of pressing international, national, or state concern. These germplasms basically are only allowed to be owned by certain state governments or national governments, according to current law. So any close contact with these germplasms puts people in potential great legal risk. That's the idea. So I wanted to look and see what that distress was like, being in close contact with these types of germplasms, and how patients cope with that. And importantly, is their relationship, is the distress that they face when they're associated with these things pathological, or is it really a normal response to a structurally imbalanced system? So one way to get guidance from that is the Diagnostics and Statistical Manual of Mental Disorders, the DSM-4. So you can look in there and you can find that there's actually a category that looks at legal problems as it relates to a pattern of cannabis use. So if a patient has a maladaptive pattern of substance use, which they say can be manifested, leading to clinically significant impairment or distress as manifested by recurrent substance-related legal problems occurring within a 12-month period, this can actually be a diagnostic criteria for a mental abuse, a drug abuse mental disorder, substance abuse mental disorder. I found that problematic because I wanted to actually, I think this is missing some of the variables, intervening variables in all of the actual nature of legal problems that patients face. Sometimes it's through no fault of their own. But it turns out that the DSM is very clear that possession is a legal problem that can be suitable for a diagnosis. And this is actually a theme for all the substance-related disorders in the DSM. So the issue is that the laws at the federal level for cannabis are so divergent from the laws at the state level. So the Congressional Research Service report told us that the federal penalty for possessing one marijuana cigarette, even for medical use, is up to 1 year in prison and a $100,000 fine. And the penalty for growing a cannabis plant is 5 years in prison and a $250,000 fine. That patients are willing to risk these severe penalties appears to present strong evidence for both the substance's therapeutic effectiveness and their urgent need for relief. Very wise words from a federal employee here. So, and to go even further than that, I just want to mention that in our system, we actually have a death penalty for cannabis.